Hey guys, my name is Ashley.
And I'm Lucia. Welcome back to another episode of 76 Cents Pod.
In this week's episode, we are basically doing a tribute to 1 year since the shutdown due to COVID-19. So, very exciting. We're going to be talking about COVID and, what we've done this past year and things like that. So, stay tuned.
Yep. Let's just get the ball rolling. Where were you when you found out that COVID-19 was shutting everything down?
Well, okay, so this I need to go like a few weeks before
Set the
COVID like
story.
really, really shut everything down. So basically, I was supposed to take a trip to Rome with one of my friends, and another one of our friends was actually studying abroad in Rome. So we were going to visit her during our spring break. But then, like a couple weeks before, Florence in Italy had a major breakout of COVID. And so we were like, oh no, like, are we going to be able to go? And then it spread down south to Venice and to Rome. So then we were not going to be able to go to Italy. So then we decided to go to Disney World instead. Maybe not the best idea. But at that point, we didn't know that there was that it had gone to the United States yet. So we were like, we're fine. Like, we'll just wash our hands while we're there and, you know, be as safe as we thought we could at Disney World at the time. But so we were there on our spring break, and then when we were actually like in Disney World, like in one of the parks, we were waiting in line, and we both received an email that we would have our spring break extended another week. So we're like, oh cool, like we'll just have another week off and then we'll go back. And then we never went back. So yeah, that's how I found out pretty much
Yeah.
that everything was
Kind of
shutting
similar for
down.
me actually. I went on a weekend spring break trip. Like it was like from Friday to Sunday. And I think it was like it was actually like a week before March 13th, which is what a lot of people had as their spring break. But I just remember at the time I was still working as a barista. So I had my last shift and then I was like, oh, like we're gonna have a good time in the mountains, and we did. And then I came home for the week and I was like, I'm just gonna have spring break at home because my parents didn't want me to go anywhere because they were a little bit worried about COVID at the time, but obviously we didn't know like how bad the cases were. It's just that in North Carolina there were like reported a couple, so it was just for cautionary measures. But then on that Friday, like of spring break, I was like, I don't think I'm going back to school. And then a few hours later, my school chancellor sent an email, and yeah, spring break was extended. So then at the end of that second week of spring break, they're like, actually, you're not coming back. So like everyone can just schedule time to come back to move their stuff out, and we'll see you never. And that's how it happened for me.
Yeah, I remember so I didn't live on campus. I lived in an off-campus apartment at the time. So like that wasn't really a problem for me, but for a lot of my friends, they like couldn't get their stuff from the dorms, and like they only had packed for like a week off, so they didn't have like all of their school stuff and things like that. So it was like a really big problem actually, like for people to be able to go back and get their stuff. I forgot about that.
Yeah, because like one of my friends lives in New Jersey, so she literally went home for the spring break and she only brought a week of stuff. And then she had to stay there until she was able to like book her time to come back because they were only allowing like a couple people back at a time. And then you only had 2 hours to move out. So it was just very like chaotic and kind of stressful. But I guess we all figured it out, and we at least got like part of a refund for our housing because we didn't live on campus for the rest of the year. So that was better than nothing.
Yeah, that honestly still sucks though.
Yeah.
Uh, that's terrible.
It's
Great times.
yeah, memories. Like I feel like the first few weeks went by so fast, and then after that it was so slow because we were just doing the same thing.
All right. Well, that's how we both found out about the shutdown. But what did you do like during the shutdown, like during the first part of it? Like
Yeah,
what did
so
you do then?
the first part of it was like, I think this is similar for a lot of students, but we were still in school, so everyone was like adjusting to having online classes and everyone was at home. So, okay, in my house, like I don't even have a study area now because like the study room that I used to use is now my dad's office. My sister studies in her room. So I was just like literally taking tests and doing my homework on the dining room table, which was really weird, but I didn't have anywhere else to do it. And then like I don't know, there's just a lot of changes very quickly. And then taking final exams also on that table. And a lot of the time they're either recorded or like timed or, just online format. So, I mean, I don't think anyone expected it, but it was just very interesting to see. Yeah.
Yeah, I'm kind of the same except for like I have a desk in my room, so I just like did all my stuff at my desk in my room pretty much. But I was living in my apartment that was like closer to campus, but then I just moved in like with my parents because there was no point in me being downtown by myself. Um, but yeah, so pretty much my two other roommates also went back home, except for one of them kind of stayed because she's from farther away. So like she just it was easier for her to stay some of the time in the apartment. But it kind of sucked because we still had to pay rent. And at
Yeah.
first, like people in the group message with my apartment building, they were like, dude, it's stupid that like he's making us pay rent and like blah blah. And I was like, I mean, I kind of understand because he still needs like a source of income, but then now I'm like, it was kind of stupid that he made us like pay rent still and people weren't able to work and things like that. But like he could have at least delayed it. Like,
Yeah. Or like reduce the price or something.
yeah, but he didn't do that because he was mean. I was trying to give him the benefit of the doubt, but then everyone roasted me in the group chat. So I was like, okay, sorry. And then we found out that like attempted to rob a bank like years ago, and I was like, so I no longer support this man. I will no longer be giving him the benefit of the doubt. Like, sorry, bro, you lost me there. But yeah, so I just came pretty much back on track. I came back home and just did my schoolwork and stuff here, and it was not fun trying to navigate that. But
Yeah. And then like stage two is like the summer. And then okay, what did you do over the summer? I feel like it was nothing, but
I actually did like go on a road trip with my family to visit my sister. So, you know, like we had packed up all our masks and everything and like we were really like as safe as we could be. Like we didn't go anywhere that had like a ton of people. Like we went okay, except for we went to Mount Rushmore and we didn't realize like we had
oh,
gone like the day after Trump gave a speech there. So like there were a ton of Trump supporters there when we rolled up and I was like, okay. But like
awkward.
that place is actually kind of busy and we were like, okay, we're just gonna like go in, see it, and then hop on out. And it was actually very like underwhelming. It was so stupid. I'm like, y'all really ruined a sacred mountain for this?
Mm-hmm.
But anyways, then we drove through Yellowstone, which is really nice because like you can drive through it and like not have to get out of your car. I mean, we got out of the car to see certain things, but um it was really easy to like stay away from people there because it's a ton of open space. And then what else did we do? We yeah, we pretty much just kept driving all the way to Oregon, which is where my sister is, and visited with her and visited my mom's best friend who's also in Oregon. And of course, they were all just like in shutdown as well. So we were just like staying at their houses and just like hanging out. Then we were supposed to go down to California to visit like my grandma and my mom's family, but it was really bad there. So they were like, just don't even like worry about it. So then we just decided to drive back home. And yeah, it's pretty much what I did over the summer. And that like we spent a good amount of time on that road trip. So yeah.
Yeah. Yeah, I forgot about that. I do remember you telling me like about visiting your sister. That sounds fun though. Like at least you got to see some scenery, some landmarks and such. But yeah, it probably would have been better if you had like, I don't know, more chances to meet with people, your family. Yeah.
Yeah, but it was still good that we were able to, like, get out and, like, do stuff kind of like we weren't, like, out doing anything crazy, but we went on hikes and stuff while we were in Oregon as well, and just things that we could do without being around people.
Yeah. Nature is good. I spent most of my summer inside because I was tutoring, so that's my job now, but all of the tutoring is online. So I would spend like 3 hours every weekday online. And then the rest of the day, I didn't really know what else to do because like my hours were at like a really weird time of the afternoon. So it's like either I had to do everything in the morning or I would have to do it like in the evening. But like at that point, like I can't even go outside or like anywhere fun. So like there wasn't really a point. I just kind of took a lot of walks around my neighborhood and actually did read a lot of books, but they're like all books that I read before. So whatever I had in my house, I was reading it. Um, Watched a lot of movies and TV, but like besides that, I was just kind of chilling. Yeah. And then we come to phase three, which was fall semester online. And I guess it kind of leads to now. Let me just say online learning is just a mess and these people, some professors are nice, but some professors are just, they really expect too much from us when they already know that we're struggling and they know that learning is harder and they still try to make things difficult. And I'm just telling you, if you're that type of teacher, please reevaluate because I don't think like you can't just expect us to be okay after we've all been experiencing, such a time, and you can't expect us to be learning the same and doing the same amount of work when we just literally don't have the brain capacity to do that.
Professors expected that, like, students would just easily transition into online school, and I'm like, "That's literally, like, a completely different form of learning, like, that's not gonna go over well." Like, you have to reformat your class to accommodate that. You can't just be like, "Alright, guys, we're gonna do this the exact same way, just on Zoom." And I'm like, "Dude, like, you gotta cut us some slack, honestly, because, like, asynchronous classes, no, that I cannot, like, do that."
Yeah. And then like a thing that I noticed because I'm a tutor, as I said before, is like since a lot of students also might have learning disabilities or just like they need accommodations in the first place. So like now that you're expecting even more, like it's harder for them to adjust. And we don't know like the best strategies yet because we're all doing this for the first time. So it's like it's just kind of like if you're not being an understanding professor and instructor right now, then like I don't know what you're doing in education because you should at least like try to have some care, like passion for your students and like I don't know, just be empathetic to what they're going through.
Yeah, I think the problem oh, sorry, I got a notification. I didn't know I upgraded my, like, computer, and I don't know why it's suddenly, like, dinging. I don't
It's
it's
fine.
not happened to me? Okay, anyways, that's what I was saying. Like, some professors just, like, from the get-go, like, even in person, like, they did not care about their students. They were just there for, like, research or whatever reason, and they, like their first priority wasn't to teach that class. So, those
True.
professors certainly did not make it easier for online. But I feel like a lot of my professors that I had, like, made a good effort to try to make it easier for us, luckily.
Yeah. I think some of the best things that my professors did were like opening exams for like a whole day. So you at least had some time to take it or not having a time limit or just making it open note because like at this point, like it doesn't really matter if you're cheating because like you can you if you're not like okay, education I think focuses too much on that anyways because no one thinks about learning. They just want to memorize things. And that's like literally why people cheat anyways, because they want to get a good grade. But like if you're really focusing on actually learning the topic, you shouldn't really be concerned if people are using their notes or whatever. So I really respect the professors that allow us to like use our notes and our resources, because that's how it works in the real world. Like you're never going to be taking a test in your job and not like be able to look things up. It's just, I don't know, it's just like unrealistic to think that you're not going to have help.
Yeah, I think in some situations, like, having to memorize things does make me learn it better because, like, otherwise, like, I might not study as much. But yeah, I did take, like, a linguistics class, and we just had a midterm, and it was open notes. So, I really liked that. But, like, for other classes, I can understand why, um like anatomy and physiology, like if you're gonna go into medicine, like you just need to know that. Like,
Yeah.
I mean, you don't need to know every single detail, like you can look some stuff up, but like if you're like working in a fast-paced setting, I could understand like how you would straight up need to know like off the top of your head some things. But most things, like in most jobs, like you don't have to do that. Like you have resources available to you. So I don't understand why professors just don't let you do that.
Yeah. It's just annoying. And like, I don't know, they just don't respect. I guess they don't respect students and they don't think that like we can do well without cheating or something. I don't know.
Also, like,
Anyways,
I've known multiple people who have gotten like academic integrity um punishment or whatever for using Chegg on like homework assignments. And I'm like, dude, they used it on their homework. It's not like they used it on a test. Like, at least just give them a warning. Like
yeah.
if
Or
that's a
like,
defense, like I feel like that's you're taking it way too seriously, you know?
yeah. Or like just teach it better so they don't have to resort to like looking it up. Cause like if they actually understand how to do it, then like this wouldn't happen, you know?
Or like if they could look in your like PowerPoint slides or anything and like be able to find it there, or like
Yeah.
maybe that would be better. But I don't think you should get mad at students for like using the resources that they have available to them for things like homework. But I mean, I understand if it's like an exam, then yeah. But if you don't allow your students to use things like that, like tell them ahead of time because half the time professors don't like say whether they care or not. And so that's where students are like, oh, I thought it was fine because it was the homework. And then they're like, no, like that's cheating. So I feel like
Yeah.
professors just also need to be clear in what their expectations are. And that's a lot harder with it being online as well, but you still need to do that.
Yeah. I think good communication is key. Alrighty, let's see. Going back to the topic of COVID. So what are some things that you want to do after COVID, if it ever ends?
Well, I got my first shot for the vaccine, so hopefully like once we hit some herd immunity in here, like we can start getting back to normal somewhat. But, I would really like to travel like anywhere on a plane and not have to be super stressed about it. And definitely go to Europe because I was supposed to go there and I still haven't been able to. Um, yeah, like that's pretty much the main thing is I just want to be able to travel to different places, but I can't right now, which sucks.
Yeah, me too. I think something that I just took for granted is just like being able to meet with people or like even be on campus daily. Like, I mean, I've been there a couple times, but it's just not the same when you're like really distant from everyone. And I'm obviously not taking my lectures inside and like I'm not enjoying my time on the quad or like studying outside or anything. Just the little things that you don't think about, but like you do them so often that it just feels weird that like we're not able to. Like even like going to a movie theater, I used
Stop.
to just
I
sit
love
next
the
to
movie.
random people. Yeah, we just like sat next to random people and watched those movies. But now it's like I don't even want to step foot in there unless it's like we're 10 feet apart. Like I'm not sitting next to you. Like it's just a whole big deal. So
Yeah. Also, okay, so there's this one movie theater here in Columbia. It's called the Nickelodeon, and they have a lot of indie films, and it's like a local like place, and they support the arts and everything. And so I like going there. Like I used to love going there all the time. Like I would go there by myself and just like if I had free time, I would be like, let me just go catch a movie at the Nick, and it was great. And now I can't do that, and it's so sad. Because it's also cool because it's like movies that wouldn't be in the normal movie theater usually. Like I wouldn't watch a lot of like international films or anything like that. Just like I don't know, ones that I found interesting that weren't at the normal movie theaters. And so I really have missed that because I used to be like something that I would do all the time. And it was like a nice thing to just do by myself. Now I don't have that.
Yeah. Yeah. Another thing is like, okay, I probably will still wear my mask after like, I get vaccinated and everything, but I think since people are so annoyed with it, like they're gonna be super happy that they won't have to anymore. But I probably still will. Like I just don't I think now that we're much more aware of sickness and like and just like spreading disease, that like if I am ever sick again, I will literally just wear my mask in public because like there's nothing that's it's not gonna hurt me. Like I'm just trying to protect other people.
Yeah, it kind of grosses me out though that like we used to have to go to school even when we were sick and like go to work even when we were sick. And I'm like, that's actually disgusting. Like, why can't you just give someone the day off? But
Yeah. Like it just shows you that like our society values like productiveness and work more than like your literal like well-being, which is
yeah.
just depressing.
And I genuinely think it's like just America that's like that. Like everywhere else have like way more vacation time than us, like in Europe. But over here they like to grind us down to the
Yeah,
bone.
I agree. It's so many comments I can make.
Like, why
Um,
is it normal for us to work 8 hours every single day and then only have 2 days off? Like, something about that just doesn't sit right with me.
it's too long. Like, why is it 5 to 2? Like, at least 4 to 3, I could understand, maybe.
Yeah.
And
But
then like
like,
even like maternity leave, paternity leave,
yeah,
like we have the shortest one. I'm like, you think a mom who just gave birth is ready to go back to work? No,
yeah,
no,
like straight
no.
up, like her whole body just got like her whole world just got rocked, dude. Like she can't even walk right now. And you want
Yeah,
her to be doing that. She's wearing some Depends. Like,
yeah. She has
no,
diapers on.
she don't need to be worrying about work right now. You can chill out. But
Yeah.
also, like, just I don't understand why I can't just be like a hunter gatherer or like if I live a sustainable life and I can provide for my own needs, why do I still have to pay taxes? Like, I'm just
Mm.
worrying about myself, boo. Like,
Yeah, let me just go into the woods like Henry David Thoreau. Like, kind of had the right idea.
yeah, but now our whole society is like dependent upon money.
Yeah. Money is not even real, first of all, but that's another problem.
Yeah, like what is
Mm.
currency? It's a lie. It's just not real. It doesn't exist. And if you're an econ major and want to argue about it, don't because I you will not change my mind.
Yeah, anything you say to me, like, I still don't understand what it is.
Yeah,
How is money real? It's literally numbers on a screen.
yeah.
Okay.
And if you try to tell me, "Oh, it's backed up
To
by,
where?
like" yeah, literally by what? We don't have any gold. What do you mean? By credit? We made that up.
Cash? That's just paper. I can rip it up.
That up.
I
We made
can
this
burn
all
it.
up. But that's a topic for another time.
Anyways. Anyways. Let's see. Um, okay, here's a good question. How long did you expect the pandemic to be?
Uh, Not this long, that's for sure. So, okay, when it first started, I was like, okay, we're gonna have a shutdown for a little while, and then like hopefully we can kind of get back to normal, right? Like I
Mm-hmm.
feel like that was what I expected. or, like, at least, like, it being over by the end of the summer. Like, I thought by the time we would get back to school in the fall, like, it would kind of have died down. No, it's still going. It's still going strong, and it's so
Yeah, I think I had the similar thoughts because, like, the first initial thought was like, if you guys all stay inside for 2 weeks in March, like, literally the spread will stop and we'll be fine for the rest of the year. But then nobody did that. Like, I did it, but
yeah.
not enough people did it so that it could actually be safe. Because, okay, like, I just remember seeing people post on Instagram about their spring break trips even after they had already heard about, like, closing, and I was like, I would have understood if it was a week earlier because we didn't know, but now you're still going? Like, how about you
Yeah,
save
like,
your
no,
money?
honey, that's supposed to be canceled by now. Like,
And they
no.
were always, like, gathering in the most, like, people dense places, and I was like, "You could have gone hiking in, like, I don't know, the Sierra Nevada or something, but you had to go to Cuba. You had to go to the Bahamas, like, I don't understand."
Yeah, and also, like, back then, everyone was talking about, like, "Flatten the curve." We've had, like, 4 curves, like, total. Like, it
It's
just goes,
still
like,
going.
woo! It just goes up and back down and up and down, and I thought we were just doing one little hump, like,
Yeah,
but no, that was sadly incorrect and
yeah.
ignorant of me to think.
The hump, like, literally just started going down. Like, I heard that the levels are just now hitting what they were in October, which is, like, 4 months ago, which is just really sad, but I guess I can't really be surprised because people don't wanna be told what to do. Like we said last time, like, if people tell you to wear a mask or tell you to stay inside, you're just not gonna do it because of psychology.
Yeah, like, y'all just are told to do something and you're like, "Ah, it's taking away my freedoms. I don't wanna do that." And I'm like, "Please just listen so that we can be done with this, please."
Yeah, like, I really, like, stayed inside my whole summer for that, and then I still couldn't go back to school, but it's okay. I think if I had to make a guess as to when it would end, um, given that the vaccine distribution goes well and people actually get it so that we have herd immunity, I think I'm gonna make a rough prediction that by the end of this year, it'll be starting to go down, like, back to normal. I don't wanna, like, jinx it, but I just feel like it is kind of going slow right now, and there might still be, like, little outbreaks or different strains or whatever, but I think since the science has gone by pretty fast and more people are getting vaccinated, that it will at least there will be a little bit of promise.
Yeah, the only thing that I'm worried about with that is, like, the antibodies are only gonna last us so long, so, like, we're probably gonna have to get vaccinated again, most likely. I don't know, like, if the healthcare, like, community has said anything about that yet. Like, we're just worried about getting everyone vaccinated, like, right now. But are we gonna is it gonna become like the flu shot? Like, are we gonna have to get vaccinated every year for this? Like, how is that gonna work? But yeah, I feel like the end of this year is, like, possible, but realistically, I think, like, the effects of the pandemic are still gonna be lasting for, like, a long time, and I don't know if it'll ever really be, like, done, you know? Like, Texas just took away their mask mandate, which I
Mhm.
personally don't think that's a good idea at this point because, we haven't had that herd immunity yet, but I don't know. I think it just
Yeah.
depends on how it all plays out.
I did hear, like, someone told me that the reason they did that is because the vaccine is available to everyone, but, like, at the same time, not everyone's gonna get it, and, like, just because you have it doesn't mean you can't catch it, so it's just kind of like they were just done with the mask mandate even though, like, the virus is still out there, so I'm just gonna keep mine
Yeah,
on. I don't live in Texas, but
sure.
even if I did, I would still wear it.
I think, like, I already got my first shot for the vaccine, and then my second one is gonna be in April, so my thing is, like, if you have to get 2 separate shots a month apart, like, there's no way that enough people are vaccinated in Texas for, like, them to be taking that away this soon. Like, maybe in May, like, they could argue, "Oh, like, we've had it available for a few months now to everyone," but, like, I feel like not everyone has gotten to their second round, so it doesn't really matter if it's available to everyone if they haven't had the chance to get the second shot yet.
Yeah, and then after you get it, you still have to wait, like, a few weeks, and, like, what if you booked your appointment really late, or there's just, like, a lot of logistical problems with that, so I feel like most people would be eligible to get it by May, right? Like, that's what the president said, but that doesn't mean that everyone will be able to get it. So, yeah, definitely probably will take longer, and, like, as you said, the economy has been impacted, like, everything has changed, like, we're never gonna go back to how it was, but I think people just wanna feel more reassured and safe, so we'll see if that happens.
Yeah. So for the vaccines for North Carolina, like how are they doing that? Because I know in South Carolina we have different phases. So like right now we just started phase 1B, which is like frontline workers, teachers, and like education staff. So how is it working for y'all there?
Yeah, so I think we're also doing phases, but the first one was, like, essential workers, second one, I don't even know. I think we're on, like, 3 now, but just, like, a few days ago, the governor opened it up to anyone with, like, pre-existing conditions for COVID, so, like, if you have asthma or if you're obese or, like, anything that would make you more vulnerable, so I think a lot of people are happy with that, and then I guess actually that's group 4. I don't remember what group 3 was, but basically, like, the only group left is just, like, regular citizens and such, so I still have to wait because I don't work somewhere where I'm in contact with people, and I'm not an essential worker, and I don't have pre-existing condition, but, a lot of people were, like, concerned, about the pre-existing conditions, which is, I think, why they moved it up. So, hopefully it goes by pretty fast. I don't really know, though, because I feel like the only places where it can really be administered are at, like, really big hospitals, like research universities, and then maybe a couple CVS's around the state, but I don't know if that's actually happening. Yeah.
That's interesting. Yeah. So I think people with pre-existing conditions, at least in South Carolina, were like within the first phase, I'm pretty sure. So I think they have had access to the vaccine here at least. But yeah, I think for here, I know most like grocery stores that have a pharmacy, you're able to get it at that pharmacy, like Costco, Kroger, Publix, even, or maybe not Publix. I don't know. But actually, no, Publix, because I went to Publix today
Mhm.
and they had little seats that said like COVID vaccine. So yeah, so like anywhere like a grocery store, pharmacy, and then um I think hospitals, and they have some little like drive through like pop-up ones. So yeah, that's kind of
Yeah,
helpful.
I was talking to my sister about this, and she was like, "Maybe we should just go to, like, a CVS and, like, loiter there," because, like, at the end of the day, they're gonna have leftover vaccines. I just don't know where, like,
Yeah.
exactly they're doing it.
Honestly, like, you might be able to get it through your job, I feel like, since you're a tutor, but maybe since you do it virtually, it doesn't count, but
Yeah, they
at least
actually
because, like,
emailed me
I get
about that. Mhm.
yeah, since I
Yeah.
get paid through the university, like, that's how I was able to get it, but also whenever I went to get it, they just asked me, they were like, "Oh, like, what part of the group are you in?" And I was like, "I work at USC," and so they were like, "Okay," and they didn't ask for proof or anything, so really, if you wanted to, you could just
I probably
make an
could.
appointment.
Yeah, I just, like, filled out, like, a survey that they sent me, and it was like, "You're not eligible," and I was like, "Oh, well, maybe if I show up, they'll just let me have it," but it's okay. I don't mind waiting, but I think if you can get it, you should just get it anyways, and, like, I see a lot of people getting it already, and I don't know how they're getting it, but, like, I'm not gonna stop them because it's not like you getting a vaccine is stopping anyone else from getting a vaccine. Like, you should just get it because it'll go bad anyways.
Yeah, exactly. I think the problem here right now is that, like, all the appointments are booked up. So, like, because we just entered, like, phase 1B, which I don't understand why it's, like, phase 1B, like, why don't you just call it phase 2? But, um, yeah, that's the problem here now is that the people who are, like, wanting to get it, but they, like, didn't sign up right away, like, all the appointments are booked, so that kinda sucks. But hopefully
Yeah.
they figure that out. And hopefully none of the vaccines go to waste as well.
Yeah. I did read, like, an article a month ago about this doctor who he was monitoring, like, a COVID vaccine line, and then at the end of the day, he had, like, 9 left, so he asked people if they wanted it, and, like, some people took them, but then he just took them with him in his cooler and started vaccinating people in his neighborhood who had, like, pre-existing conditions, and then he got fired for that. And I was like, he's literally doing his job by protecting people and using the vaccine because he was told you need to use this if you can, otherwise it's gonna go to waste. And then he got fired. Like, what is and I just hate the healthcare system here. I'm
Yeah.
sorry.
I mean, I think I understand, like, where they're coming from because it's not technically like he wasn't going along with protocol
Yeah.
by doing that, but I think if they said, like, "Try to use these," like, what did they expect him to do?
Yeah. Like the reason that they said or like one of the reasons he was fired was like because he provided too many vaccines to like the Indian community because that's like just where he lived. And then they were like, well, that's not equitable. But I was like, what do you want him to do? Like he's just literally trying to use them up. Like it's
Ew.
not like he was singling out like random Indian people. It's just like he happened to be in that place. I don't
Like,
there's the
just
whole
tell us that
yeah.
you're racist already. Like, just say
Exactly.
it. I'm
Exactly.
sorry, like, why is that the first thing that y'all thought of? You're like, "You're giving it to too many Indian people." What?
Exactly. That's like the whole reasoning. I was
That
just
doesn't make any
confused.
sense. You could get mad for him, like, doing it not in an environment, like, that he was supposed to give the vaccines, but you
Mhm.
can't be like, "You gave it to too many Indian people." What?
Yeah,
What is
exactly.
wrong
Oh
with
my
y'all?
god.
Also, that reminds me of the whole Meghan Markle and Harry interview, but just
Mm,
not watch the whole thing, like, y'all just
that was
really blatantly
dramatic.
showing your racism at this point. I can't.
Yeah, they really thought like her child was gonna be like so dark, and I was like, isn't she half black? Like, so now you're colorist and racist, and you just don't like they didn't even support her. Mm-mm, that whole family needs to
Yeah,
go.
and, like, she literally her skin is so light and Harry is, like, pale, so
Hmm.
why was that a concern for anyone? Like, y'all are so stupid. No offense, but actually full offense, like, y'all are dumb. Also, the fact that, like, Prince Andrew is straight up a terrible human
A
being,
pedophile.
like, and y'all just brush that under the rug, but when Megan is like, "Yeah, I actually wanna die," like, y'all are like, "Okay." What?
Yeah,
What's wrong with y'all?
yeah. I mean, actually, that kind of relates to like the healthcare system in COVID because like racism is systemic, like we know, but like I think in considering COVID, like we've heard all about the anti-Asian racism. That's not structural racism, but like that's still happening. But then also like if you're if you're black or Latino, you might not have as much access to these vaccines or just healthcare in general. And then let me just this is a story from my school, but like after our basketball games, they always like storm Franklin Street if they win against Duke. And I thought these white people would not do that because we're in a pandemic, but we won 2 games against Duke. So like every time they would go and storm the streets, basically causing a super spreader event. I mean, I don't know if the cases actually went up, but like just knowing that they're out there. Um, but then you think about like they're all white, but like the town that's right next to our school is like primarily a black population. And it kind of just speaks to how like those privileged white students don't even think about how they're impacting other people in their community just because they literally don't have to think about it. Like, oh, if I get COVID, I'll be fine. Like I can just go to the hospital or like whatever. But then like the same like poor communities next to them literally don't have an option. Like they don't have access to that stuff. So I don't know. It's just something that's been on my mind recently.
Yeah, I kind of hate when people are like, "Oh, well, I'll be fine if I get it." Like, I hate that. I think that's a stupid mentality. I'm not gonna lie. Like, you're only worrying about yourself.
Mm-hmm.
And I don't know, a lot of the people that I know even like kind of have that mentality where they're like, "Well, I've already had it," or "I'm young, like I'll be fine." But I'm like, I literally like work with other people all the time and I babysit too, and like there are just too many people that I could pass it to where I would feel like terrible. And then I live with my parents who like they're not old, but they're like not young either. So
Yeah.
like I just don't understand how people just don't care about that at all.
Yeah. Yeah. It's just very problematic. Like, let's just have some compassion for other people. We're
Yeah,
on
like
month
stop
12
worrying
of a
about yourself.
pandemic. Yeah.
And like the fact that we had to convince people to wear masks by being like, "Oh, well, it's protecting you from like other people too," and you're blah blah. Like, bro, just wear it for the sake of the community. Like, it's not that hard.
Yeah. And then some people were saying like there's no proof that it works, but there's literally proof. Like there's literally studies. They did studies. How about you go read them? But then
And
they probably don't understand the study. Like it's just too much.
I feel like it's also like low key common sense. It's like if you sneeze, it goes everywhere. Like we've always been taught to sneeze into your elbow so that you don't
Mm-hmm.
spread germs to everyone. It's literally the same concept, but instead of your elbow, it's just always there on your face.
Yeah.
And I'm like, how is that not so simple for you to understand? Like, it's literally the same concept that we learned when we were like 5. It's the same thing.
And then people take it off to sneeze, and I'm like,
Bro,
that's
this
literally
defeats the
defeating the
whole
entire
purpose.
purpose. Oh, I hate it here.
Oh
Let's
my
see. Any more
gosh.
questions? Okay, here's a question for you. Do you think the United States will ever be prepared for another pandemic? Or what should we do so that we are?
Um, First of all, our entire healthcare system is garbage, so like probably not.
I agree.
Also, the people don't want to listen to anyone, so that's another reason that we probably wouldn't be prepared. I don't know. It's just like the whole thing is so inefficient. Like our whole system is stupid. So I don't think that not in like the near future, like we wouldn't be prepared. But maybe like a long time from now. I don't know.
Yeah. This is kind of related to what I was just reading about last week for my public health class. Um, Public health in the United States is only like 1% of like the budget that the military has, which that's already an issue,
Don't even
but
get me
then like
started on that military budget. Don't even get me
yeah,
started on
but
that.
then you think about like how many things public health encompasses, like safe water, sanitation, um, housing, food and drug administration, anti-smoking campaigns, gun laws, I don't know, like seatbelt laws. But then like if you think about how many things are covered and then how little funding they get, that means like every program literally gets less. And so obviously there is benefits to investing in public health, but like we said in our other episode, people don't really think about it because it's not like the changes are not coming like rapidly. So like anything you do, if you pass like a law that bans smoking or tobacco sales or something, like it'll work, but it will take a while. Or like it might not work as well as you thought it will, but like overall there will still be probably a positive effect. And so that's why people don't think about like they're only worried about like directly getting treatment at like a hospital or whatever, which is fine. Like obviously you need to get help if you need it, but just the fact that us as a country, we don't care about prevention of health problems is why we are so like not prepared for things like this because no one ever is thinking about like how I don't know freaking climate change could even bring across more pandemics, but we're not investing in things that are going to try and stop climate change. You know what I mean?
Yeah. Honestly, like, I just don't understand why the military needs so much money. Like, we
Same.
have we put so much funding into our military compared to other countries. It's ridiculous. Like, it's literally insane. And I
I
just
don't
don't
know what they're
see
using the
the
money for.
benefits. But, like, yeah, exactly. I'm like, where is that money going? I haven't seen any benefits of that. Like, and of course, people are like, oh, they're protecting our country. Of course, but also, like,
From
we
what?
are bombing other countries that
Yeah.
maybe we don't have business, like, bombing them. Like,
Yeah. Like, I don't understand where that argument comes from because, like, who are they protecting us from? No one is like, no one is trying to invade the United States. Most of the time, it's probably like over oil or something. And then they just use the budget for weapons. But like,
exactly.
we don't, it's not even necessary because, like, what? This is not helping anyone and
Yeah.
just using all of our money.
But also, yeah, and then it's the people who, like, who don't want universal health care or don't want the minimum wage to go up, and they're like, "Well, it's because I don't want my taxes to go up." I'm like, "Maybe the reason your taxes are so high is because our spending on the military is, like, astronomical." Like,
Yeah.
if you take the funding from that and put it towards something that's actually gonna help the American people, maybe that makes more sense, and then, like, we wouldn't have to be paying a crap ton of taxes for something that doesn't even do anything for us, like.
Yeah. Exactly. Like, if you had even taken like a few more percent of the military spending and just put it in healthcare in general, like maybe we would see some, large changes in how things are run, how effective it might be. Yeah, like right now, I know everyone's heard, but like ICU is probably pretty full, like understaffed as well. And then all these people are working overtime, but they don't get paid enough. And then like it's just a very hard and like sometimes demeaning job. But their job is still necessary. Like the military is not always necessary, like probably not at all right now, because what are they even doing? I don't know. But just thinking about how they value that more than they value the frontline workers. This really bothers me.
Yeah, and, like, I'm not gonna pretend to know everything about the military, but I think we could at least cut the budget from the military, like, a little bit, like, there's no need
Yeah.
for it to be as high as it is right now, and I do like that the military gives people, it gives them jobs, it gives them, access to healthcare as well, and, meals and housing. But the fact that people have to join the military to get those things is kind of sad. Like, you wouldn't just have them have access to it normally.
Yeah.
But I mean, like, the military isn't completely a bad institution. Of course, it's necessary to a certain extent, but I don't think it's necessary to put as much money into it as we are right now.
Yeah. Um, I think that kind of wraps up our COVID-19 discussion. I mean, we did go a little off topic, but they are related. Do you have any last thoughts on the pandemic or what do
I
you think is
just
going to happen next?
want it to be over, but I don't think that's going to happen for a long time because people can't get it into their heads that, first of all, it's real. Second of all, that they need to do their part. So please do your part. And that's pretty much all I have to say about it.
Yeah. I think if you guys don't want a repeat of summer 2020, um, you can stay inside right now or, get your vaccine. And with with enough people getting it, we could possibly be out of this by the next year. Um, Let me knock on wood. But I think that it can be possible if everyone pitches in. So yeah. Well, great talk. If you enjoyed this episode, please listen to another one. Got plenty out there. Like, comment, subscribe. Anything else? Rate, review. Any
Yeah,
ideas? Yeah, if you have ideas, let us know.
let us know. Hit us up. Definitely like, comment, subscribe, all of that good stuff that Lucia already said. But we will see you next week.
Bye.